Title suggestion: bloodless surgery. Safer, cheaper, faster. The shocking scientific truth. Part 2. Blood? What does science really say? The surprising history of bloodless medicine. Imagine you are in an operating room, lights dimmed, monitors pulsing, a full team moving with absolute precision. The surgery is extremely delicate: open heart, major orthopedic reconstruction, organ transplant, and yet not a single blood bag enters the scene. It might sound like science fiction, but it's not. It is reality. A documented, studied, and adopted reality all over the world. This is the story of a shift few people know about: the revolution of bloodless surgery. And this raises an important question. If for decades transfusions were believed to be indispensable, why are so many surgeons today choosing, when possible, to avoid them? A revolution born from necessity and confirmed by science. For many years, medicine viewed alternatives to transfusions with suspicion. They were considered risky, marginal, and even extreme. But in recent decades, something happened that no one expected. In 2004, a group of researchers wrote a surprising statement. Many of the techniques developed for patients who refused blood will become the therapeutic standard in the future. Source: Continuing Education in Anesthesia, Critical Care and Pain, Volume 4, Number 2, page 39. This was not just an opinion, it was a signal. Medicine was changing direction. Complex bloodless surgery. Today, it is a reality. Today, thousands of doctors worldwide operate without resorting to transfusions. Not in minor procedures, but in some of the most difficult. Cardiovascular surgery, open heart. Major orthopedic surgery. Transplants. Oncological surgery. Complex trauma surgery. And we are not talking about isolated attempts. These are successful operations documented in prestigious medical journals. Here are some of the primary sources: the Journal of Thoracic and Cardiovascular Surgery, Volume 134, Number 2, PPI 287-288, Texas Heart Institute Journal, Volume 38, Number 5, Part 563, Basics of Blood Management, Part 2, Continuing Education in Anesthesia, Critical Care and Pain, Volume 4, Number 2, Part 39, Heart, Lung and Circulation, Volume 19, Part 658. These publications tell a truth that seemed unthinkable just a few decades ago. Patients operated on without transfusion often recover as well as, or even better than, those who receive blood. Why can avoiding transfusions be an advantage? This is not an ideological matter. It is science. Over the years, studies have shown various risks associated with transfusions, even when performed correctly. Immune reactions, pulmonary complications, bloodborne infections, rare but not zero, increased recovery times, higher incidence of post-operative complications, risk of human error, mislabeled bags, incorrect identification, the journal Transfusion and Apheresis. Science, Volume 33, Number 3, PR 349, also highlights a very interesting point. The cost-benefit ratio of bloodless medicine is often more advantageous. Fewer transfusions does not mean less safety. It often means higher quality, greater attention to the patient, and more surgical precision. Innovative techniques, now common practice. What was once thought of as only for those who refuse blood is now used on all patients, even those who would accept transfusions. The most common techniques include intraoperative blood salvage, cell saver, rigorous control of hemostasis, use of medications that stimulate red blood cell production, EEG, EPO, controlled hemodilution solutions, advanced scalpels that reduce blood loss, e.g. ultrasonic, preoperative anemia management, microsuturing strategies that minimize hemorrhaging. And in the journal Heart, Lung and Circulation, 2010, we find a powerful statement. Bloodless surgery should not be limited to one religious group, but become part of normal surgical practice. The patients, who chooses it? Initially, those requesting this type of care were mainly people following specific biblical principles. But today, the situation is different. Today, many non-religious patients also choose to avoid transfusions, when possible. Why? Because they want safer, less invasive, more body-respecting surgery. And this choice is becoming increasingly widespread, even in developing countries, because it reduces both costs and risks. No proof that those who refuse blood die more easily. Another myth to clarify. Some say those who refuse transfusions risk their lives. But published studies say otherwise. It cannot be proven that a person will die because they refuse blood, nor that they will live because they accept it. On the contrary, important data published in the Journal of Thoracic and Cardiovascular Surgery, Volume 89, number 6, Panay 918, and in Heart, Lung and Circulation, Volume 19, PN 658, show that patients operated on without blood, including children, have clinical outcomes equal to or better than those who receive transfusions. Medicine looking towards the future. Looking at the data and publications, one point is clear. Bloodless medicine is not a fallback, it is progress. Progress born out of necessity, grown through research, and now adopted by hospitals worldwide. And as science moves forward, more specialists are understanding that the human body, when properly supported, can manage without much external blood. In video 1, we saw the spiritual side, why true Christians choose to adhere to the biblical command to abstain from blood. In this video 2, we have seen the scientific side. Modern medicine not only allows this choice, but often considers it preferable. Two worlds, faith and science, that do not contradict, but converge. Thank you for watching.